You know what's worse than bad hair day? A no hair day. If your hair is shedding like a golden retriever in summer, iron deficiency might be the culprit. Let's fix it before your hairline starts costing you. Tried every shampoo or serum and nothing helps with hair loss? Here is something most people miss. The root cause might not be on your scalp. It could be inside your blood. Today, we are talking about iron deficiency and how it silently shuts down your hair growth. Let's dive in. Most people think of iron for energy and red blood cells, but your hair follicles need it too. So hair loss isn't always hormonal, it can be metabolic. And let me show you how iron can affect your hair. Iron is essential for producing hemoglobin, which carries oxygen in your blood. Without enough oxygen, hair cells, which are some of the fastest growing in your body, don't get the energy they need. The follicles shift from growth mode to rest mode, called telogen, which leads to shedding. It's not only the lack of oxygen that causes hair loss in iron deficiency, it's only one factor. Iron also plays a role in the enzymatic reactions that are part of keratin production, the protein hair is made of. Or, for instance, chronic iron deficiency may trigger inflammation, which can further impair scalp health. Iron in your blood is like cash in your wallet, used daily. But ferritin, that's your saving account. If it's low, your body starts cutting back, and hair is one of the first things to go. I've had so many patients with normal iron in the blood, but extremely low ferritin, and their hair was falling out fast. Fixing ferritin fixed everything. Real patient case. A woman came to me in tears over her thinning hair. She tried everything, minoxidil, PRP, expensive treatments. Her labs said her iron was fine, but we checked her ferritin and it was 80 nanograms per milliliter. It's low. Once we raised it above 55, her hair stopped shedding and started growing again. The lesson: don't guess, test. Let's talk about who's more likely to have low ferritin. If you are a woman with heavy periods, monthly blood loss can drain your iron stores fast. Vegans and vegetarians are also at risk since plant-based iron isn't absorbed as well as heme iron from meat. Endurance athletes, you burn through iron faster, especially through sweat and training. And if you have gut issues like IBS, reflux, or inflammation in your gut, your body might not absorb iron properly. If any of that sounds like you, this message is especially for you. In my consultations, I recommend aiming for ferritin levels roughly equal to your body weight in kilograms. So if you weigh 60 kilograms, you want your ferritin around 60 nanograms per milliliter for healthy hair growth. Let's talk about food, because yes, you can eat your way to better iron levels. The best kind of iron is called heme iron. It's found in red meat, poultry and fish, and it's the easiest for your body to absorb. But don't worry if you're plant-based. Foods like lentils, chickpeas, quinoa, pumpkin seeds and even cashews can still help. Just be smart about how you eat them. Combine them with foods high in vitamin C like bell peppers, parsley or fermented veggies to boost absorption. Soak or cook your grains and legumes to reduce the anti-nutrients that block iron. And avoid drinking coffee, black tea or milk with your meals. They can block iron too. It's not just about what you eat, it's also how you eat it. Sometimes diet isn't enough, especially if your ferritin is low already and you have symptoms. Supplementing iron then can help, but it's important to do it under medical supervision since there are toxic dosages and there are conditions when you can't supplement. The best form I recommend in consultation is ferrous bisglycinate. It's gentle on the stomach and highly absorbable. These are a couple of examples that I'm using from iHerb. If your hair falling out, don't just read the outside. Get your labs checked and support your body from within. Healthy hair starts with healthy blood. Have you tested your iron or ferritin? What did you find? Let me know in the comments and hit like, subscribe for more science-based health tips.